Hi, everyone. Thanks for joining FCA's first webinar. This is a new experience for us, but I'm going to give a brief opening statement, and then we'll launch into data presentation and a discussion on COVID. For those of you that are not familiar, FCA International was established in 1946. It's about 75 years old, and the Atlanta chapter is actually about 50 years old. There are 35,000 members worldwide, and we have approximately 300 in Atlanta. We do a lot of work with Dobbins Air Reserve Base here in Marietta, and we also partner with government, industry, and academia to create a collaborative environment for the sharing and creation of knowledge. As we start talking about the topics for our first webinar, post-pandemic, COVID actually was kind of a natural topic. There's been a lot of resources deployed in Georgia, both on the data side and on the physical asset side. So I've got Bharat, who is keyed up here to give his data presentation. And Bharat, if you want to go ahead and take over, go right ahead.
Thank you, Paul. Good afternoon, everybody, or should I say good noon? I wonder if anyone says that. Thank you to the FDA and AT&T for this opportunity to share the work that we did. Before discussing our findings, I just wanted to introduce myself. My name is Bharat Bhatia. I'm a volunteer with ATLytics, a 501c3 nonprofit with over 1,500 participants and members. We specialize in providing Atlanta with analytics for community service. The mission of ATLytics is to leverage Atlanta area analytics talent and resources. We seek to identify insightful and actionable information that will help the most vulnerable members of our community. So we try to use analytics and technology for the betterment of humankind. Our three action pillars are advocacy, strategy, and community. The advocacy pillar incorporates disseminating knowledge on analytics, communicating the value of analytics, and then illustrating ways to leverage data to reach organizational goals. For the strategy pillar, although we're an altruistic organization, we do have to apply business principles. So we develop an analytics culture, and we identify data collection and data management activities and use tools to help establish successful analytics functions. We have to assess and evaluate options and define sustainable goals. For the community pillar, we have hackathons. I actually started getting involved in ATLytics through a hackathon in human trafficking. We also have consulting projects for different nonprofit organizations to address certain community topics, one of which is the opioid epidemic. And we also have an NPO referral program for volunteers, which allows the volunteers to get involved with a certain nonprofit, almost like an apprenticeship or a non-compensated employee, which allows them access to sensitive data. So it's good experience as well for people who are trying to get their feet wet. So this is our team of very talented individuals, and we looked at the trajectory of COVID-19 in Georgia and developed a dashboard with the data that was available to us. So this is a great team that I had the pleasure of working with. They had an immense amount of talent. Now here is the Florida dashboard that inspired us to develop one for Florida. Now this is the one that we saw at that time. This is not up to date. At the bottom you can see the link of the Florida's dashboard with the updated numbers, but this is a screenshot in time of the dashboard the day we saw it, and we decided we wanted to develop something for Georgia. So this was around April. So here's a timeline of different different dates in Georgia. So the first reported case of COVID-19 in Georgia was on March 2nd. In April 3rd, that's when the shelter-at-home order was put in place. So that allowed only essential businesses to be open, such as grocery stores, hospitals. Now, there were reopening dates. May 1st was when all businesses were allowed to open, albeit with some restrictions, but there was a few early reopenings. April 24th was when gyms, salons, tattoo parlors, barber shops, massage parlors, those kind of businesses were open on April 24th. April 27th, restaurants were allowed to open for dine-in. Prior to that, they were only allowed takeout. Now, they did have certain restrictions on capacity, but April 27th is the day when they were allowed to open for dine-in. And then June 16th, there was an executive order that was created June 11th, but it was effective June 16th. That allowed restaurants in Georgia to open at full capacity. It also increased the capacity of bars and public gatherings from 10 to 50 people. And the shelter in place for those 65 and older was lifted on June 16th. So looking at some of the peaks, April 17th was the first peak before Georgia reopened, and it was about 2 weeks after April 3rd. Now, 14 days is the incubation period, which is the time it takes for COVID-19 symptoms to develop, but the average is about 45 days. Now, up until June 20th, there was no peak that surpassed April 17th, but on June 20th, there were about 1,800 cases, which is about 4 days after the June 16th lifting of the 50 or more people limit. On June 26th, there was a 3-day period of new records for 3 days straight. So 1,900 cases on June 26th. The next day was 1990, and then over 2,000 on June 28th. And now yesterday was a new record of over 2,900 cases. Now here is a graph of daily cases and deaths in Georgia. And you can see over here are the key dates. As I mentioned before, this is the incubation period, averages about 45 days. So when we look at some of the new records of cases, so April 17th is about 2 weeks after
showcasing your amazing products. And I just want to leave you by saying very important words. God bless America. Thank you all very much. Thank you. Thank you.
Thank you. So April 3rd was when the lockdown occurred, and so the peak of 1525, that's a little over 2 weeks, about 2 weeks after. So that was a period that allowed the effect of the closing, the lockdown to occur. Now, although there's an increase later on of the number of cases, April 7th is still the peak of the number of deaths, and even past reopening, there was no new peak in number of deaths, possibly because we're getting better at treating COVID-19. Now, we have to look at number of tests when we're looking at the number of cases. So a lot of people assume that the reason why there's an increase in number of cases is because of an increase in number of tests. But when we look at it, the peak number of tests was on May 25th at 31,000, over 31,000 tests, but there was only 506 cases. If you look at post-June, you see on June 26th, that's when the new record was of cases, about 1,900. And then three days of straight records, and then ultimately July 1st, another record. You don't see as many tests occurring. So these increases are happening despite the testing, and not it's not just a matter of increased testing. It's also true that when we look at New York does a whole lot of testing, much more than Georgia does. And for a while, New York did have more cases, but once we get around June, we can see a decline in number of cases each day in New York, whereas in Georgia, we start seeing a hefty increase. Since June 20th, New York hasn't had a single day where there were over 1,000 cases, while Georgia, you can see consistent increases and consistent new records. In fact, on June 20th, you start seeing over 2,000 cases a day on key dates. This isn't only true in Georgia. You can see in Texas, Florida, Arizona, you can see that there's been quite an increase in the number of cases, despite having far fewer tests than New York. In fact, in this period, past June 20th, the highest number of cases that New York's had has been 805 cases. Now, this is the dashboard that we developed for Georgia. In addition to the cumulative count, we also felt it was important to have the number of cases and deaths on the most recent day. So this is as of July 1st. Here's the graph that shows testing data versus cases, and then this is the cases and deaths. This chart is the cumulative cases. So although there has been decreases on certain days, the total number of people that have COVID-19 is still consistently increasing. There's still more people getting the condition than recovering, and we still haven't flattened the curve. We wanted to look at assisted living facilities, since people 65 and older do make up a large number of the people that have COVID-19. So there's two types of facilities: nursing homes and personal care homes. More or less, they're quite similar, but the nursing homes deal with people with chronic conditions, heart disease, and disabilities, and other things that need more care. We tried to look at staff infections compared to resident infections and resident deaths. We can see that there's a lot more of these cases and deaths in nursing homes. Now, they also had a higher number of residents, but when we look at the percentages, about a quarter of residents in nursing homes are infected, whereas with personal care homes, it's about 8%. And when we look at the number of deaths that occur, nursing homes make up close to 40% of Georgia's deaths of COVID-19. So it's very important to look at how the care is given in these facilities. So we looked at staff infections compared to resident infections in over 499 facilities, but these are the top 10. And there is a 0.70, the correlation coefficient is about 0.76, which is a high correlation. The assisted living facility with the highest number of cases was Pruitt Health, Palmyra. We also look at deaths, and we see some similar facilities, although there is some variation. Westbury Medical Care is first in deaths, but second in cases. But overall, there is a strong correlation. The correlation coefficient of staff infection to resident death is 0.72, and the correlation coefficient of resident cases to resident deaths is about 0.86. So there's a strong correlation we see right there, and so it's important for the staff to be very careful about use of PPP and other methods of trying to control the spread. Here are sources that we used. We used COVID Tracking Project and Johns Hopkins, Georgia Department of Health, and then the CDC. And if you'd like to get involved in ATLytics, our website is atlytics.org. You can go to the site and press the heart that leads you to a form where you can fill out your interest and skill set to see what kinds of projects you can work on. You can also check out Tag Data Science and Analytics podcast, which is hosted by one of our brilliant co-founders, Dr. Beverly Wright. You can also compete in hackathons like the ones that I did in human trafficking, and we've also done one with Porsche on air quality. And now I would like to open it to questions.
So let's do this. If you have a question, put it in the chat, and we'll get it to Bharat. We'll do a couple minutes of questions, and then we'll move on to the COVID discussion. So does anybody have any questions? I don't see any coming in. So, Bharat, I've got a quick question for you. You hear on the news about the variances in days, and some days get a peak of data, and some days don't. How do you adjust for those variances when you're looking at these graphs?
Adjusting variances on the quality of the data, do you mean?
Well, where the data comes in, well, they'll say like you have, a bad day that has like, 2,500 cases, and the next day there's like 20. But it seems like the data is coming in inconsistently. Do you guys just ignore that, or do you build a model around that?
Yeah, just whatever the data is for the day, that's what we analyze. We didn't try to, we didn't filter anything out, or so that's the best way to find out what's going on is see the data as is. Obviously, while patterns exist, of course there can be a day where it might slightly decrease one day, but when we look at the overall pattern in Georgia, for example, and Florida, we can see around the end of June 20th and later, we do see a overall uptick occurs.
Okay. Well, we do have a question coming in. Somebody's asking about any reasons for the high death rate in the Southwest Georgia area.
In the Southwest Georgia area, so we'll need to look more look at some more data to really come to a conclusion about that. A lot of it, I think, is just patterns that are happening in Georgia in general. That the reopenings are maybe more lax than states like New York, and then now with restaurants opening at full capacity. And there just may be certain regions that are more lax than others. Also, another thing we need to look at is individual behavior, so wearing of masks. And so there may be areas where some people are less likely to wear a mask, and more people, other places where more people wear masks. And since there hasn't been any mandates to wear masks, it's really all about individual behavior. There is tracing data that's going on right now, and so I think as we go into that, we can get a more definitive idea. But
and that's what there is another question was asking about contact tracing.
Okay, what's the question about contact tracing?
It's like, are you doing anything contact tracing, like who's getting it from going to bars, parties, grocery stores, etc.?
So we didn't get an opportunity to work on that yet, but we are, we're of course continuing. We're still doing more research, and yeah, that is something that we're considering looking at. From what I've seen, a lot of it is mass gatherings in bars, beaches. I think, especially in Florida, for example, where you have these huge crowds of people not wearing masks in close proximity. So that seems to be the general tendency of where a lot of these increases are happening.
Okay, and the last question, do you have any information on the update of a vaccine?
Nothing so far. I mean, so far I think they're still working on it. And I think even if you look at Dr. Fauci and some of the experts, they're working on a vaccine, but they don't have a definitive timeline of when it's going to be available.
Okay. Well, very good. Well, we're going to shift the conversation now, and thank you very much, Bharat. The data kind of paints a stark view here. But so, James?
Can people hear me now okay?
I can hear you now, okay.
All right, very sorry. I do apologize for that. I am overseas, and so my internet connection is in and out.
Very good. So we have a conversation here with Brigadier General Wilson. If you guys want to kind of jump into the conversation, introduce yourselves, and then let's go.
Excellent. So I'll kind of get this conversation. I will get this conversation started. Brigadier General, thank you so much for being with us. We really do appreciate you taking time out of your schedule to join us for today's awesome webinar, and thank you for Paul and Kathy at AFCIA for putting this together. We're very grateful for everything that you do to our community. There's an echo. If someone could please go ahead. Excellent. So I'll just come off and say, everyone, first of all, a happy 4th of July, Brigadier General. Thank you so much for your service. Thanks so much for being with us. We do appreciate it. Obviously, COVID-19 was something that no one planned for. It wasn't in any contingency, wasn't on any business plan. It wasn't anywhere near what people were planning for 2020 when we welcomed this year. It has caught us all off guard. How did the governor utilize the Georgia National Guard? What was your objective when mission began to deal with COVID-19 in the state, and how has that evolved now when we're almost 4 months into this pandemic?
Yeah. Okay. Well, hey, first of all, let me thank you guys for allowing us to participate in today's discussion. I've got a little bit of a team assembled here. So, I'm Dwayne Wilson. I'm the director of the Joint Staff for the Georgia National Guard. My primary responsibility really is to just help coordinate and synchronize our response effort from our headquarters here, really for the
General back on, sir. Can we get a quick sound check just to ensure that we are on a good landline for our discussion, sir?
Yeah, I can hear you guys perfectly. How can you hear me now?
If we heard you any better, it would be in person. Excellent.
Okay. Yeah.
So
yeah, I can start where I left off, maybe, if that's okay, or whatever you guys want me to do.
yes, please, sir. The stage is all yours.
Yeah. Okay. So I've got a team of experts here with me today. So I don't know if that came across last time or not, but I've got Colonel Alex McLemore, who is one of our brigade commanders. A lot of his forces, a lot of his units, soldiers and airmen, were doing some of the missions that we're going to talk about. I've also got Colonel Shane Strickland here, Chief Information Officer in J6 for our headquarters, as well as Lieutenant Colonel Pat Watson, who's our public affairs officer, has played an integral part in everything that we've really done since we started. So this started for us really back at the beginning of March. One of the first requests that we received was from the Department of Health and Human Services to use some of our facilities here at Clay National Guard Center, which is co-located with Dobbins Air Reserve Base, to house some American citizens who were coming off of the cruise ship, the Princess Diamond, at the beginning of March. So that really was the first thing that we took a look at, just with supporting, and then we kind of grew from there. By the 14th of March, I think Governor Kent had activated 2,000 members of the Georgia National Guard, and then later we increased that cap to 3,000. And so we started off initially with a smaller footprint. We placed some liaison officers down at the Georgia Emergency Management Agency headquarters. We had some logistics folks start helping different agencies throughout the state as we were really ramping up and trying to anticipate what we thought were going to be some requirements for us. By the second or third week of March, one of the first things that our Adjutant General, Major General Tom Carden, had us look at was just anticipating help inside of our regional hospitals throughout the state. There's 14 regional hospitals, so we got a little bit innovative, I guess. We don't really have the structure in place for this, but we pulled medical professionals outside of some of our units in both the Army and Air Guard, and we built these teams, which we called medical support teams, that we could place in the 14 hospitals across the state, and they could provide some just additional help. And as cases started to increase and hospitals started to see more COVID-19 cases in each of the hospitals, so those teams were primarily made up of. We had a few doctors on the teams. We had some physician assistants, a lot of nurses, and then both Army and the equivalent in the Air Guard of medics. Teams were anywhere from 10 to 15 strong in number, and they just recently ended that mission in those hospitals across the state. Started off with the regional hospitals. I think by the end of the thing, we were actually in about 22 hospitals across the state helping out. That was one of the first missions that we supported. And again, that one was it's not, there's no playbook that we had on the shelf for that. We working with GEMA, working with the Department of Public Health, and really the governor's COVID-19 task force. Just trying to be anticipatory there and determine early on where we could place some folks to help out. One of the second things that we started doing early on, again, we realized that one of the most vulnerable populations in the state was going to be individuals that were living in nursing homes and long-term care facilities. And so I'm going to let Colonel McLemore here in a little bit talk about this, because a lot of the folks that did this were in his brigade, and they've just done a great job, since the beginning of this thing at trying to reduce risk across the state. But we built, again, no playbook. This wasn't a core mission of anybody's, but we built some teams. We called them infection control teams. They were about 10 to 15 soldiers and airmen on each team. We equipped them with some commercial off-the-shelf disinfecting equipment, and really targeted all of the 790 nursing home and long-term care facilities across the state. Now, there's more than 790, but there's 790 that the Department of Community Health identified for us that had 25 beds or more in the facilities. And so started that again mid-March. We're still doing some of that now as we start to finish up. But we disinfected all 790 of those facilities. Some of them several times. I think to date, those teams, we went from a single team early March to over 65 teams, and then I think we've disinfected over 2,300 actual facilities. Most of them in that nursing home long-term care facility market multiple times, but we also use those teams to do some other work across the state as well. And for first responders, we kind of looked at the food market a little bit too, and sent the teams to do some disinfection control, or infection control rather, and in some other facilities as well. So that was kind of a second big mission set for us. Still doing that one now, and then a while back, again, probably mid-April, beginning of May, through the governor's office and the Department of Public Health, we wanted to increase testing across the state. And so, we created some mobile testing teams. Again, soldiers and airmen, some medical professionals, and we kind of stayed along the same strategy that was developed. We focused our efforts on trying to get into some of the nursing homes, long-term care facilities to test both, to really provide an opportunity for testing for both patients and the staff that were working in those facilities, just to increase testing stats across the state. So again, focused there, and then that spread first responders, again the food industry in the state to just increase testing and those populations as well. We're still doing some testing now as we finish up. A fourth mission that we were asked to do, and this really proved to be very, very valuable across the state, is having our soldiers and airmen augment staffs in food banks across the state. So there's 10 regional food banks that we've had folks working out of, and then within the metro area, there's about 10 more kind of local food banks that we've provided some support for. And just to give you some stats there, just for the Fulton County public school system, we provided almost prepared and then served almost 1 million meals over a 2-month period during the month of April and May. I think to date, when I look at the other 10, the regional food banks, and since we started, we've packaged and palletized about 76 million pounds of food and then prepared. That equates to about 40 million meals, served to folks that need them, to Georgia citizens that need them across the state. So that's a great one. We're still doing that one too as we finish up as well. And then the last thing that I'm going to talk about, just giving you an overview of some of the missions we've been doing before I kind of turn it over to these guys, is training. So as soon as we started doing the infection control missions, we started having other states, other agencies within the state reach out to us for some best practices and some lessons learned. And so we had our state safety office, along with Colonel McLemore and his team, and one of our other brigade commanders and his team, just developed some tools, some training tools that we could send out to different organizations as they started to do very similar missions, across the state or outside of the state as well. I think we provided a training video to all 54 or 53 states and territories through the National Guard Bureau. That was pretty valuable. I think our state safety office and team trained about 37 other agencies across the state, some federal, state, and at the local level. Trained about 1,000 personnel on how to go in and disinfect facilities, and I want to say out of that 1,000, about 600 of them were part of the university system of Georgia. So that as we started to open colleges back up here in the fall, there were some lessons learned from us were being shared with those individuals going forward. So those were probably and then just liaison missions. We worked down at a couple of warehouses in the state for GEMA. We've had folks in call centers for Augusta University. I mean, there's a lot of missions, but those are the 5 ones, I guess, that we've been supporting since this thing started. And I'll pause there in case you have any questions.
So and that's great. Thank you so much, Brigadier General. I'd like to kind of take this conversation for a topic that's really important for a lot of people that are on this call, which is the private-public partnership during COVID-19. Can you share with us how you guys initiated a private-public partnership and what that looked like?
So, yeah, so I will use one example, and I don't know if you heard me when we first started, or if we got cut off and we were kind of going through some of the audio challenges. But you know, we everything that we do, really, we do through the Georgia Emergency Management Agency, you know, and working alongside and with and through other state agencies. So you know, the Department of Public Health, I'll use testing as an example. So they've been the state agency lead on testing. And so, you know, one of the things that the governor's office wanted to do was increase testing throughout the state early on. And so the Department of Public Health reached out to Augusta University Health and the Georgia National Guard, and we helped stand up additional specimen collection sites or testing sites across the state. So the Department of Public Health, you know, had their sites established, and then through Augusta University, we were able to stand up about 10 more sites across the state, using equipment from AU, using AU's lab just to increase capacity. So that's probably a good example of that.
Excellent.
Yeah.
Thank you so much, Brigadier General. I do appreciate that, and you guys have done really impressive work in such a short period of time, helping the state really deal with the pandemic. As we shift through from private-public partnership to innovation and technology, in one of our pre-calls this week, you guys actually did develop your own dashboard, your own technology and innovation around this that was featured in an Army Times article talking about how the Georgia National Guard actually did this. Would you mind sharing with our audience a little bit about what you guys did and why the Army Times picked you guys to feature for this?
Yeah, no, I'd love to. So that was and again, nothing that we really did by ourselves. We working with the Department of Public Health, the Department of Community Health, and the governor's office. We realized that we could provide some assistance to DPH, the Department of Public Health, on how we track COVID cases, positive cases for both patients and staff in our nursing homes and long-term care facilities, as well as testing stats for those folks as well. And so, really, Colonel Strickland and his team worked with DPH to develop a dashboard that would basically make tracking all of those metrics a lot more efficient. So it's probably a pretty good segue for me to hand it over to Shane. I think some of you know him as well, but I'm going to let Shane talk that one. But just did a great job within about probably 3 days or so of us realizing that maybe we could help create a different way of managing the data. Shane had a dashboard in place, and both the Department of Public Health and the Department of Community Health, liked the dashboard so well that I think they're still using it today to manage data. So I'm going to turn it over to Shane at this point.
Thanks so much, General.
Hey, so this is Colonel Shane Strickland. As General Wilson mentioned, the CAO G6 for the Georgia National Guard. So he hit obviously hit all the high points. So early on, we all knew that our long-term care facility, that our elderly population was going to be a focal point, as we did COVID operations as that high-risk community. So working with DCH, at the beginning, DCH was actually using what they term as surveyors, the individuals that work for DCH, and they were calling these different facilities, the 790 long-term care facilities across the state with 25 beds or more, and getting the report of COVID positive cases, who was hospitalized, COVID deaths. That's where it all started, and obviously that data was lacking just because of the process of an individual calling 790 different facilities and trying to update one spreadsheet. So they had one spreadsheet that they were all sharing. So through collaboration with the Georgia Army National Guard and DCH, we developed a database with an online entry form so that the facilities could go in and upload their own data. And then that would populate the database. And then we took the database and fed it in through business intelligence, Power BI, to create this dashboard that would give near real-time data to our senior leaders, to include the governor's staff. So the governor's staff, Department of Public Health, Dr. Toomey, and then our adjutant general and other senior leaders were all using this dashboard. So again, that just provided that near real-time information, that decision quality information we're looking for, so we know where to focus our efforts. As we continued, that database continued to grow to where we started capturing the infection control teams, which of those facilities had been disinfected, as General Wilson mentioned, and we also started to track testing. So we were tracking testing results and who was positive there for both the residents and the staff. So that's where, and I'm sure many people saw, as DPH has been reporting through the governor's office to the general citizens of Georgia, the testing percentages for those long-term care facilities, where last report we saw the governor's office reported we were up to 100% of all residents tested in those long-term care facilities. So a lot of that data was being fed from the DCH Georgia Guard database and dashboard. And then the final thing we did, and again, you talk innovation and continual improvement. So as we continue to improve that database, which fed the dashboard, the last thing we're tracking now is recovered. So we've gone from just tracking patients or residents that death or positive for COVID, to residents that were tested, to residents that have been hospitalized, and residents that have recovered. So we're tracking the recovery rate now at those long-term care facilities as well. So that was the one of the bigger innovations we did, and one of the reasons why, as you stated, Army Times kind of picked that up as a way to provide some of that analytics to our senior leaders, again, through the governor's office at the highest levels, on where we need to focus our efforts to help protect that high-risk population, specifically the long-term care facilities. And as of yesterday, actually, 1 July, we had our first big conference call with the Department of Community Health, DCH. So the database and dashboard that was created in support of them, we're going to move that to their organization now. So as of right now, the Georgia DoD is still kind of housing that database and managing it for DCH, in support of DCH and DPH, Department of Public Health, Department of Community Health. But what we're doing, as we start kind of spinning down to some of our COVID operations as a Georgia Department of Defense National Guard, we're moving that database back over to DCH, providing them some resources to house that dashboard. And just like General Wilson mentioned, that they're going to continue to use that going forward, and it's going to be their new kind of standard of operations going forward to track some of those long-term care facilities. So that was the specifically the article and one of the bigger innovations that we've done. And while General Wilson has given me the floor, I'll also mention another smaller one, which I was very excited about. So as we talk about conducting operations, as a state, and we had teams, going everywhere. We were also able to field some new communications equipment down to the brigade level that they're using to report back, and so that was kind of a rapid initiative building that we pushed hard to get some of those comms out. So it's everything from what we call Nighthawks, which is a Wi-Fi device. We were able to provide Meraki's to help support some of the testing sites. Meraki's, I'm sure most of you are familiar, another Wi-Fi capable device to reach back to AU's internal network, and we're also able to provide additional cellular phones and options. So anyway, I'll stop there. But so on the database side and on the communication side, some of the innovations that we did, and hitting your question.
Excellent, and thank you so much for that, Colonel. We are almost out of time, and in respect of that, I will revert now to our audience. If you would please write your questions in the chat, and for the gentleman here, and we'll be happy to answer those. While you do that, though, I will say that AFCEA is always happy to welcome new members. So if you're not a member of our chapter, feel free to either contact Kathy or Paul, myself, or anyone else to become a member of AFCEA. We're definitely growing in Atlanta, and we'd love to have you be a part of us. You can obviously write your questions in the chat with all, or send them to me directly, and we'll be happy to answer those as we wrap up. Obviously, we've got about a minute left, and if nothing comes in, then in the next few seconds, I will.
We do
Go
have
ahead.
one question. We do have one question where they're asking how you balance the need for quick response, but keeping people calm, like in the assisted living facilities, with vulnerable populations. Hey, and that's a great question, and I think I was looking for just an opportunity for Colonel McLemore, one of the brigade commanders, to kind of get in on the discussion. So I'm going to let Alex answer that one, but I just want to say, that really, I think, one of the most valuable things that we were able to do was focus our efforts on both the patients and the staff in long-term care facilities and our nursing homes. As you saw the stats in the brief earlier, 40 to 45% at any given time of deaths in the state were coming from our nursing homes and long-term care facilities. And so I without a doubt believe that the efforts of Colonel McLemore and his team, really did make a difference. I think that rate could have been much higher, and the fact that our folks were getting in there, disinfecting, and trying to do some targeted testing so that we could put some mitigation procedures and stuff in place where we needed, really did save some lives. So I'm gonna turn it over to Alex, who'll answer that question for you. Alex.
So I think the question was more geared towards how do we balance our response with the requirement. We're used to you call us and we're there in a hurry. So when we first started this with that facility down in Southwest Georgia that kind of helped us establish the standard operating procedures that we distributed, now nationwide, we realized real quick that unless the facility had issues that they knew about and they were already made public, that not all of them were very eager to have us come in and do disinfecting or eventually even testing, because they either didn't want to know or they were worried what the outcome would be if it was identified that they had issues. So our ability to respond was often a lot quicker than the facility's desire to have us come in there and help them. It took a while for us to convince the state as a whole, that community as a whole, that we were just there trying to ensure that we kept those people at a reasonably health protected level where they wouldn't burden the hospital system any further. So I'm not sure if that answered the question, but I realized I only had 60 seconds, and I hope that helps. Over.
It does, and we've got one more question. Thank you so much for that, Colonel and Brigadier General, and thank you so much for the Georgia National Guard. We are out of time, and so what we'll do with the few other questions that have come through, we'll send those via email, and for everyone who's been part of this first webinar series for us here at AFCEA Atlanta, we'll be sure to send those responses written out for you guys to enjoy as well. I do want to thank the Georgia National Guard and Lieutenant Colonel Watson as well for helping us put this together, the public affairs officer for the Georgia National Guard. If it wasn't for his diligent work, we wouldn't be able to bring you this amazing content. So Lieutenant Colonel, thank you so much as well for your help in facilitating this panel. Folks, with that being said, I'm sorry?
No, I said you were talking. I was just going to wrap it up.
Yes, sir. I'll wrap us up right now. So, folks, thanks so much for joining us. My name is James Azar. I'm a virtual chief information security officer, and I forgot to introduce myself when we started, so I'll do that at the very end. People dropped off, don't know who I am. They just see a guy who's in Israel moderating this thing, because I'm the only crazy guy that gets on a 12-hour flight overseas with a mask on the entire time. With that being said, folks, thank you so much for tuning in. I really do appreciate it. Thank you to Paul Cathy, the Georgia National Guard. We will be reposting this on our website and through various channels on LinkedIn and other places, so you'll be able to share this as well with your friends. Thank you to Bharat and ATLytics for their donation of time and knowledge to our chat today. On behalf of everyone, happy 4th of July, folks. Be star-spangled awesome and enjoy your weekend. And we'll have more content coming from FC in the future.
You guys have a fantastic holiday.
Yeah, thanks again for the invite. Certainly glad to be able to participate. You guys have a great 4th of July weekend as well.
Very good.
Thank y'all.
Bye.